Hello everybody. So today's video is by special request, and it's going to be the first of several videos on a particular topic, and that topic is called tinnitus. So tinnitus is the medical name for hearing a sound in your ears. So commonly this is a high-pitched ringing sound, but it can be other sounds as well, like static, or sometimes people say crickets chirping or some sort of sound like that. So any noise that you're hearing sort of inside of your head or inside of your ears would be classified as tinnitus. Now, at that point, there's actually two different types of tinnitus. So the most common by far is what we call subjective tinnitus. And that's where you, as the patient, are hearing a sound, but there's not any actual sound. There's nothing that's actually making a noise inside of your head. That's the most common by far. Now the other type, which is less common, is what's called objective tinnitus. And that's where there actually is something inside of your head or your neck that's making a noise that you can hear. So we're mainly going to be focusing on subjective tinnitus because it is much more common. Where does this tinnitus come from? So most commonly, what we theorize and think, and no one actually knows the exact mechanism of how this works, but the theory is as people have hearing loss or damage to their ears from loud noise exposure, it becomes basically a gap between what the current level of hearing is and what the person used to be able to hear when they were younger or before they had a loud noise injury. And what happens is our brains try and fill in that gap between what you used to be able to hear and what you now hear. So your brain's filling in that gap with a phantom noise. So that's where the tinnitus comes from. And this is actually quite common. I mean, I think tens of millions of people have this, to some extent. It's actually normal for everyone to have tinnitus on rare occasions. And usually with this, you'll hear it kind of come up, and then after 30 seconds, it sort of fades away. And that's certainly happened to me on rare instances. But if it's happening more frequently or all the time, that would be abnormal and something to be looked into. So that's going to be the end of the first video on tinnitus. At this point, you kind of have an idea of what it is. And in the next video, we'll talk a little bit more about, what we do when someone comes in to see me for tinnitus. What kind of questions do I ask them? What kind of exam and testing we do for that. So I'll look forward to seeing you there.